I'm Sheila. I'm with the PT Wound Care team, and I'm going to do the second half of my in-service, which is common wounds and peri-wound descriptors. So I will have handouts for you to look at so you can kind of look at the pictures closer. But I will start with blanchable, non-blanchable erythema. So this is usually on a pressure point. You're trying to figure out, is there pressure or is there not pressure? When you press on something that is not pressure, you should press on it and you'll get this white, the redness will turn to white, and when you let go it will refill with red or pink. That means you do not have any pressure. If you press down on the wound or the area and it stays pink the whole time, that means that you do have pressure. So for this you would need to call the doctor and get wound care orders. This we don't need to see. So the intervention for that would automatically be, if it's something on a pressure point, you'd want to offload it. So that would be your Primo boots, your Mepilex sacral borders. You put those on, and then order a low air loss mattress if the patient isn't on one already. Dehiscence means splitting or bursting open of a wound or incision. So it's something that has previously been stapled, but then pops open. If this happens, you want to put a moist gauze on this, cover it up, and call the doctor because it's going to need some sort of intervention. Denuded means kind of the loss of the top layer of skin. Sometimes it can be when an area is too wet or gets scratched or scraped. So it kind of looks like that, which doesn't translate well, but you could put like a lotion on there or ointment like Vaseline, kind of to keep it nice and moist and not so dried out. Speaking of, and then the next picture is desiccated, and desiccated means dry or just something that is overly dry and probably could use some moisture. So this would also be good for using either a lotion or a Vaseline. And we have a lotion or an ointment kind of called Sween 24, which is an SPD, and it's more like an Aquaphor. So that's really good for dry skin, scaly skin, something that's dried out. Okay, devitalized means like not great tissue in the wound bed. This you probably won't be doing anything with. If you see a wound like this and wound care is not involved, please get us an order. And then we have dusky, which is kind of like what you see on toes, or it's that purple maroon discoloration, which shows that there's some sort of sign of ischemia. If you see this on a patient, make sure you notify the doctor, and then the intervention would just be really to monitor it. Epithelialization, so that's like the new skin growing over a wound, and so you might see these on like road rash or something like that. It's good to keep it moisturized, so once again, like Vaseline or Sween 24 would be really good for that. If it's really fragile and you're worried about it opening up, you can put like a Mepilex light on it. Eschar, thick, leathery, non-viable tissue. This would usually require surgical intervention or wound care, so one of those two. If you see eschar though on toes or the heel, normally we betadine paint that to keep it dry. Any kind of eschar on toes or heels, if it's dry gangrene, you want to keep it dry and stable, so you would betadine paint it. Excoriation is kind of like linear scratching. If you see that on someone, it could be like the patient doing it to themselves or something traumatic. Usually you just want to protect that. You could put like a border dressing on or Mepilex light. If you are trying to describe granulation tissue, this is a really good example of granulation tissue. It basically looks like taste buds, red, beefy, kind of bumpy tissue, and that's what fills up a wound bed and helps it contract. You probably won't see this too often, but if you do see something like that, that's what that is. Hyperkeratotic skin, I know we've all seen this on our patients, and this is usually kind of elephant skin or really dry, scaly, cracky skin. There is a lotion called Attractane that you can order from SPD, and it's really good for this type of skin. And then ischemia, you can just see how there is not good blood flow and this tissue is starting to darken and turn kind of into eschar. This would be a surgical team managing this, and you would just be monitoring worsening of that, usually probably like a vascular consult. Okay, last page, macerated. So macerated is when you have this wet tissue around a wound or in an area, and that's usually from drainage, too much drainage sitting on the good tissue. So you would want to use a moisture barrier such as Triad or Desitin to help protect this peri wound. You also want to use Triad or Desitin when you have patients that are incontinent of stool or urine, or if they're using the PureWick because that drainage gets onto their skin and can cause breakdown, which is technically a type of maceration, but it ends up turning into sometimes a fungal infection, or it can lead to a pressure injury. Necrosis is just dead tissue. This is more of a moist eschar. This would probably need wound care or a surgery consult. And then scab, that's kind of a true scab where it's just a superficial tissue that's trying to heal up and you get this scab. It's nice to put like an ointment or Vaseline or something on here just to keep it from being so dry and stiff. It's kind of painful for patients when it's super dry. And then last but not least, slough, and this is just a wound bed with a lot of non-viable tissue. You can see little pink buds here, but there still needs to be some debridement, so this would be probably surgical or wound care. So anyways, that's a really quick rundown of some of the descriptors that we use, and feel free to use them if you're looking at a wound and you want to put some descriptors down, but don't feel obligated to be like super, you know, don't worry about if it's not super accurate, but it's kind of nice to kind of try your hand at it. So anyways, if y'all have any questions, you can feel free to Volt me or email me, and my name is Sheila Choksey. I'm one of the PT wound care therapists. Thank you so much. I appreciate it.